Well, thanks for joining me. Look, according to the data for the week ending 15th of May, about 49,000 people in England, or 1 in 1,100, were positive for the virus. It's up from 40,800, or 1 in 3,040 the week before. So we're used to this data going down. It's going up. Is this something we should be worried about?
Well, it's certainly something we need to watch really carefully. I think we were entirely predicting that cases would go up as the restrictions were lifted. And it's really just been a case of waiting to see how quickly and how fast it happens when it starts, and ultimately how big the peak is when it peaks. So, this is not a surprise, but it is a cause of concern.
Well, let's go into it a little bit. Public Health England said it was highly likely current COVID vaccines will protect against severe disease, hospitalisation and death for the India variant. But it does appear to be more transmissible than the Kent variant. Can you shed a little bit of light over what we found out? Not so much about the success of the variant. We've gone into that. That's been in the Sunday papers. But I didn't see, that piece of evidence they're waiting for. How much more infectious, how much more transmissible is it?
Yeah, I mean, I think the reason you're not seeing the data is that the data aren't in yet. What we're seeing is an increasing number of cases, but to actually get a good handle on whether it's more transmissible than the 117, you've actually got to see a trend where both are going up and one's going up faster than the other. And that's only just beginning to happen. So to be able to put a number on how much more transmissible is still really difficult. What we're hoping is that it's a bit more and not a lot more, because if it's a lot more, that means a bigger peak and a lot more hospitalizations, and we're back to where we were before.
By the way, little digression. I noticed that you used the number for the variant, not these terms, Kent variant or Indian variant. Is there something scientific, or is there about using one rather than the other, or is it more a political thing? You don't want to blame another country for a variant.
Well, I think it is somewhat unsavory to do this. I mean, we all remember President Trump calling it the China virus, and I think we all felt that was pretty inappropriate. I don't think we should be blaming the UK for 117 or India for 6172 for that matter. These viruses emerge wherever the virus is reproducing itself. And so I think probably if maybe we should find a better nomenclature that's easier to remember than these numbers, but labeling them with a place is a bit misleading, I think.
How close are we to this thing that we've been talking about since the beginning of the COVID crisis, herd immunity? Are we nearly there? And how will we know when we are?
That's a really good question. The best piece of evidence that we've seen so far, I think, that really nails this is what happened in Israel, where they obviously just used the one vaccine and they moved very fast and immunized their entire adult population pretty much. And then they saw a complete disappearance of cases in children amongst whom there had not been a single vaccine dose given. That's herd immunity. The children were not getting the infection, not because they were vaccinated or immune, but just because they weren't being exposed to the virus. So we know it can happen. And we have some idea that you need pretty high coverage in adults to achieve that.
Do you have any idea? Can you give us an idea about the sort of numbers involved in that? What the sort of proportion is it? Is it 60% or 70%, or does it require 90%? All sorts of different figures have been bandied about. Do we have any idea at the moment which of those is nearer to being right?
Well, to make it more complicated, of course, we're seeing with these figures today that there is some slippage in the effectiveness against this particular variant, and we'll see it with all the different variants. So the proportion of people you need to have had 2 doses to get herd immunity will be influenced by how well the vaccine works against the particular virus that's circulating at the time. So it's going to be somewhere between sort of 60 and 90 of the adult population, I think. And we are pretty close to achieving that. It's just that we've got a whole lot of people left to go in their early 30s and in their 20s. And so that's the gap we've got to fill in order to get to where we want to be.
I guess this is a bit unfair because I wouldn't ask the Prime Minister what he'd do if he was a professor. But can I ask you, Professor, what you'd do if you were Prime Minister? What would you have done coming up to the May the 17th deadline? Just as you're approaching it, you realise the Indian variant has increased transmissibility. You don't know the figure yet. We still don't know the figure yet at that point he wasn't sure about the effectiveness of the vaccine. If you'd have been Prime Minister, would you have gone ahead with May the 17th?
Well, I think what we've learned through this pandemic is that the mistake that always gets made is to underreact or to react too late. But, happily for me, I'm not a politician, so I don't have to deal with all these people pulling me in different directions. My instincts as a doctor are that we really want to avoid at all costs having the further health damage and economic damage of a further lockdown. So I would have been cautious, and I continue to advocate that people should be being cautious, regardless of what the regulations might be.
Tell me about
because there is a risk.
Tell me what that means, though. Caution. I don't. I hear that word. I know the things that I'm allowed to do, and I certainly wouldn't do the things that I'm not allowed to do. But I don't quite know what being cautious means within the So can you give me some examples of where you exercise caution within the rules of May the 17th, which our listeners can follow?
Sure. I mean, I continue to I isolate myself most of the time. I continue to wear a mask when I'm out and about in contact with other people, particularly when I'm inside. I take a lot of care with hand hygiene. And I continue to regard this pandemic as an ongoing problem, that even though I'm fully immunized, I'm at risk of getting the infection and potentially transmitting it to others. And I intend to continue to behave that way until this is all over. So I think everyone should take that view and not just look at the rules and say, well, I can do whatever I want within the rules.
Having asked you what you'd what it would be like if you were Prime Minister, let me now cast you as a gambler. You've got to put a fiver on whether we are going to ease restrictions on the 21st of June or not. Given all that you know, all that you realise we're about to find out, and given your understanding, presumably the mentality of the people that you work with, how likely is it we're going to go ahead with the reduction of the ending of restrictions, in terms of the easing of restrictions, certainly on the 21st of June?
Well, of course, I don't have a crystal ball, but the signs that that I'm seeing about the spread of this variant, the infectiousness of the variant, and the slight but nevertheless measurable slippage in the effectiveness of the vaccines seems to me to point to a readjustment. We're effectively in a race with the vaccine program against the virus. We know that we're letting the virus out by spreading it about now. We know that we're progressing well with the vaccine program, but I think there's going to need to be an adjustment of some sort.
And an adjustment also, I see that you've been proposing in the way that we deal with this issue of the first vaccine and the second vaccine. You're of the view that maybe we should change this strategy, just get on with those second doses more quickly, and maybe not be pushing the first doses as rapidly as a result. Is that your view?
Well, I don't think it's an either-or situation. I think they're almost like two different programs going on at the moment. There is the second dose program, which is all the people that were immunized in the early part of the year that are coming due. We've brought those forward a little bit. They're mostly people who've received AstraZeneca, some of them Pfizer. That's powering on, basically. That's going on faster than before and is a major priority. The other separate question is, what do we do with the first doses, which are Pfizer and Moderna now, because we're down people in their 30s. Broadly, the right thing to do with those doses is to give them to people who are older within that bracket, i.e. focus on the people who are in their 30s before we run on into people in their 20s or late teens, because each of those doses is going to be more effective in terms of buying or preventing hospitalizations and deaths in older people than it is in younger, even within the band of 20 to 30. So I think those two things can go on side by side, but I think that's the way we should be doing it.
Let me ask you about masks. Do you think we'll still be wearing masks this summer? And what about, will we still be wearing masks next spring?
Well, I have to tell you that this whole thing about masks has been a complete eye-opener to me during the course of the last year. I used to occasionally see people, usually from Asia, wearing masks on the underground in London and think to myself, well, why on earth are they doing that? As a pediatrician, what we've seen in the last year is a complete disappearance of a whole lot of really dreadful illnesses that children are affected by every winter. There's been no flu, there's been no what we call RSV, which is a bronchiolitis virus. And essentially by the distancing, the mask wearing, and the way we're behaving, we've wiped out the circulation of a whole bunch of really nasty viruses. So to be honest, I think mask wearing is going to be part of my life from now on. When I've got a cold in the winter, I'm definitely going to be wearing a mask because I now recognise that I can stop infecting other people and spreading infections around that way. So I think masks are part of our future, personally.
So you'll be advising, you would say to people who are listening today, you should carry on wearing masks forever.
Well, I certainly think at the moment we should be wearing masks indoors, particularly if you're indoors with other people. I really do, because the virus is in circulation. This is a virus that you can spread about without even realizing you've got it. And as we see a relaxation of measures, we're just going to see more infections. So they can reduce that or minimize that by wearing masks. I think in the future, I certainly think if you think you might have an infection, you ought to wear a mask because it will stop you from infecting the people around you, and that's a benefit to them, and it's a good and friendly thing to do.
What about social distancing? Are we doing that next spring?
So we've got to go back to some kind of normal life. We can't isolate ourselves forever. I think next spring we are hopefully going to see a situation where we're not continuing to get big waves of this virus coming through. And so, I think we ought to be looking forward to leading a life where we can mix and where we can socialize and so on. But I do think that this virus is part of our lives for the future, and I think we just will always have to take that into account to some degree.
So a couple more questions. One, a more general one about travel. People travelling from the UK will not be allowed to enter Germany. This decision is down to a rise in cases of the Indian variant in the UK. Do you think that the traffic light system is working, or do you think the government needs to think again?
Well, in terms of the Germany thing, I think the Germans are simply observing what's going on here at the moment and saying to themselves, well, let's wait and see whether this is a big deal or not. Because if, they're being cautious, essentially. They want clarification of what this Indian variant means, and they don't want to import it in bulk until they know what the consequences might be. I think in terms of the sort of travel restrictions, both give and take, that when you travel, your country's got to let you travel, and then the country you're going to has got to let you arrive. And my sense is that all of that is still in flux, and basically everyone's trying to work out how on earth to do it at the moment. It's not very clear, is it? And I suspect we'll see that get clearer over the next weeks and months. But at the moment, it's quite confusing.
Let me just ask one last thing. Dominic Cummings, he says he thinks we could have got jabs into the arm last summer. When you heard that, did that strike you as plausible?
No, that's rubbish. We were still doing the studies at that point. We didn't have any. We weren't even close to having the evidence that we needed to be able to get any kind of vaccine authorized last summer. We were getting going. We were getting started on it, but actually the speed that we did get it done, which was to start in this country in December, was extraordinarily fast, but it certainly couldn't have been any faster.
Professor Finn, hi, it's Tom here. One quick one finally from me on Mr. Cummings as well, if you don't mind. He has been tweeting again in the last few minutes. Thread number 44 of the world's longest thread now on what happened and the decisions made in government in March last year. He is saying that herd immunity wasn't a secret strategy initially employed by government and SAGE. It was the strategy. In fact, some people went on radio to explain it at the time. Did you have any understanding yourself at the time, March 2020, that the government was indeed, for a small period, trying to pursue a herd immunity strategy?
Well, I have a vague memory of hearing one interview with somebody who suggested it, and then there was a big hoo-ha afterwards. Certainly those of us who understand what herd immunity actually is, we're not thinking that, although I wasn't particularly advising the government about it at the time. Herd immunity is a concept that we associate with vaccines primarily, and certainly not with highly virulent viruses. So, yeah, I don't know what was being said in the corridors of Downing Street, but certainly it's not something that any of us took seriously as a way forward.